Welcome. Welcome, everybody, to the conference this year. My name is Beth, and I am the Group's Manager at the Stroke Association. This is my 4th year in chairing this very special event, and it's always an honour. We are delighted you can join us this morning as we come together online for our 2nd year running. At this time of year, we do normally meet face to face in a large venue in the Midlands. And we know how special being together in person is, and we do miss seeing you all. Although we can't be together physically, we can still connect and provide you with information and support. By running the event online, we're able to reach more people. We have an incredible 142 group leaders, volunteers with us today, representing over 120 stroke support groups. And we're welcoming over 50 Stroke Association staff too. The number of groups represented today well exceeds our usual numbers of around 75 at a face-to-face event. So a huge welcome to everyone. This is your conference. The space is yours. So let's celebrate all the incredible support you've continued to provide group members throughout these really challenging times. Take this opportunity to support and learn from each other. I hope you're able to make connections with others who lead groups across communities in the UK. We hope you find the next few days uplifting and useful. Take the programme at your own pace, and if you cannot attend all the live sessions, please don't worry, they will be available. Today and tomorrow, we'll be delivering 4 information giving sessions, and the programme is very much designed with you in mind. Our conference and planning group that are made up of group leaders and staff have been instrumental in working on this event together. And I want to say a huge thank you to that planning group for everyone involved in designing and shaping the content. We couldn't do it without you. So we have 2 sessions today. The first will be an interview between Alison James, who is a group leader at Falmouth Stroke Club, and Juliette Bouverie, our Chief Executive. And this will include the latest updates from the Stroke Association, the changes at the organisation, our challenges over the last year, and the highlights and how we can really work together as we move forward. Then at 11:30, we'll welcome Sophia Costa, who's one of our Group Networks officers, and she's going to introduce the new Stroke Group Network, what it is, what's been achieved so far, and you'll hear from Neil, who is a group leader at Maidenhead and District Stroke Club, about his real hopes for the network. Now, working in partnership and collaboration is absolutely a key focus of our network. So Velma and Llynos from our engagement teams from the Midlands and from Wales will share some of their experiences of working in partnership with other organisations. And I'm delighted as well to hear from Fred, who is a chairperson at Art for Stroke Folk Group. And he's going to talk about how working in partnership with other organisations has been so brilliant for the benefit of his group members. I would like to invite Juliette Bouverie and Alison James to take us in to the opening plenary about reflecting over the last year and looking forward together. So,
hi, Alison.
Hi, good morning. Welcome, Juliette, and thank you for being here with us this morning. Why did you join the Stroke Association? What makes you so passionate about stroke?
Yeah, well, morning, everybody. I just want to say what a pleasure it is to be talking to all of you this morning. Some of you may know me, but I see that nearly 50% of groups are new to this conference. So I just thought it might be helpful to say a little bit about my background. So as Beth said, I'm Juliette Bouverie. I'm Chief Executive of the Stroke Association. And I've been fortunate. I've spent most of my career in the voluntary sector. working for big health and social care charities. I worked for 8 years at the British Red Cross, and then I was 16 years at Macmillan Cancer Support. And I suppose that just really gave me a passion for improving health and social care outcomes. And we can take our health so much for granted. And yet there's so many people, as we know, who do struggle living with long-term conditions. So I'd been at Macmillan for 16 years, and then I saw the job advertised at the Stroke Association, and I just thought, wow, what a wonderful opportunity. Because I think we all know that stroke is under-recognised. Stroke survivors are underserved. Stroke feels like an orphan condition. And I just thought, wow, wouldn't that be fun to try and kind of make stroke the priority it needs to be? And, you know, I had a personal interest in stroke, Alison. Very sadly, my grandmother, who you can see on the right-hand side of this slide, she lived in Southern Ireland, and she had a really big stroke about 15 years ago. She was placed on a general medical ward in Cork Hospital. There were no stroke specialist services in Cork Hospital at the time, and very sadly she died 4 weeks later on a general medical ward without any stroke specialist treatment or rehabilitation. And I remember being very shocked and thinking, goodness me, you know, there must be more that can be done. And then the person on the left-hand side of the screen is my lovely John, who very sadly passed away about 10 years ago. But he was diagnosed age 34 with a very advanced brain tumour. And he lived for 5 years with his brain tumour. And I'll be honest with all of you, it was a roller coaster ride. It was very difficult at times. And what I didn't know at the time was so many of the side effects that he had from his brain tumour were almost identical to the side effects of a stroke. So he really struggled with overwhelming fatigue when he was tired. He really struggled with his speech. His cognition was quite badly affected towards the end. He couldn't read or write. And he also struggled with sort of kind of occasional sort of paralysis and spasticity. So it gave me some sort of insights into that lived experience of stroke, and I suppose, you know, insights into being a carer too, and how, you know, you try to put a brave face on it, but sometimes it can feel lonely. And, you know, not everybody can really understand what you're going through. And I suppose, you know, John's experience, my mother's experience, just fired a passion in me for understanding more about brains and neurological conditions. And that's how I've ended up at the Stroke Association, and it's a wonderful job. I feel so unbelievably lucky. But Alison, what about you? Because you've worked in stroke services for some time. So do you want to say a little bit about your background and how you've ended up being involved in your stroke club?
Yes, I will do. And thank you for your insight as well, because I'm sure that resonates with so many people. And thank you also for inviting me here to be with you today. I'm like really honoured. So I'm a nurse by profession, and first became involved with stroke survivors and their carers as a district nurse about 20 years ago here in Cornwall. I soon realised, like you, that the services, especially stroke specialist services for this group of people, were sadly lacking. And I suppose that also became my mission and my passion for the next 20 years. And I worked in various roles, but always in stroke, and as a stroke specialist nurse, both in the community and then in the acute hospital, mostly working in the emergency department. I'm setting up a new service there. To be honest, it's always been a complete joy and a real privilege to work with stroke survivors and their families and try and support them to face the wide and varied challenges that they face. It never seemed like work, and these families were amazing, and I was so lucky to meet them. And I also was a carer for a parent who suffered multiple strokes, and it certainly is a challenge. It's, you know, if you've been down that road, you know what it's like. It's hard. So on retirement, what to do? Well, I had been involved with Falmouth Stroke Club previously, and was really happy to be able to join them. This club is friendly, vibrant, and very active, and I'm so lucky to be part of it. Of course, like everyone, the last 18 months has been so hard to be a part, but we're back together now, face to face. More of that later. And we've been grateful also to be able to connect online as a group. But Juliet, having run this conference online last year for the first time, how are you feeling about it this year?
Yeah, I mean, yeah, I have to be honest, Alison. I wish we were face to face. I mean, I've been to the clubs conference for the last 5 years, and I've just made some incredibly special connections and had some really memorable moments. Not least of which with the dressing up box. The dressing up box at the UK Stroke Club conference was always a real feature, and we all dressed in silly purple wigs and tutus. And anyway, so I'm missing that. But having said that, online is so much more accessible. I mean, last year we had over 240 people who registered in advance of the conference, and then over the duration of the conference we actually had 550 people who joined. And this year, we've got 200 registrations from over 120 groups from all across the UK. And I think the reality is it's convenient, and particularly for groups like yourselves, who maybe who are in rural areas, it can take you half a day at least to travel to a face-to-face conference. So I think this is more convenient and accessible. We got some wonderful feedback from last year's conference, which we're building into this year's program. And there've been changes at the Stroke Association, but this continues to be one of our flagship events, and that's because we know that peer support makes such a difference to thousands of stroke survivors and their carers. Now, some of you may have noticed the sort of subtle but actually quite important name change. So the conference used to be called the UK Stroke Clubs Conference, and as Anne and Beth said, it's now called the Stroke Group Network Conference. And that word network is actually quite important, because what we're wanting to do is to connect more groups with each other, because you're the experts, frankly, in how to set up and run successful groups. And we just want to provide more opportunities for you to connect with each other, to share your experiences, to learn from each other, but also for us to hear from you in terms of what you need. So that's the significance of the Stroke Group Network.
So that's really, really interesting. And I know the Stroke Association have been through a lot of changes internally with its new operating model and a recent restructure. Juliet, can you say a little bit about this and how the changes will benefit people affected by stroke?
Yeah, of course, Alison. I mean, maybe what I might just do is just start off by saying what hasn't changed. And what hasn't changed is actually our strategy and our strategic priorities. So you can see on this slide our vision, which we developed in 2019, which is for there to be fewer strokes across the UK, and for people affected by stroke to get the help they need to live the best life they can. And that still feels as relevant, if not more relevant, frankly, than ever before. Next slide, please. And then we also have our purpose statement, which is to be the trusted voice of stroke survivors and their families. And we want to drive better outcomes in stroke prevention, treatment, and lifelong support for everyone affected by stroke. And when I say everyone, we do know there is quite a postcode lottery at the moment in terms of support. It very much depends on where you live. So we want to make sure that there is equity of services everywhere. Next slide, please. And then for those of you who've been to the clubs conference before, you will have heard me talk about our 3 strategic goals. These are the things that matter most to the Stroke Association. The first is to make stroke the priority it needs to be. The second is to ensure that everyone affected by stroke has access to the rehabilitation and lifelong support they need. And the third goal is to partner with people and communities to help them take action on stroke. So although there's been a lot of change over the last 18 months, our commitment in terms of our strategic focus and priorities hasn't changed. But next slide, please. We knew when we developed our strategy that actually we needed to change our ways of working. We're working in a complex external environment, and although we're a good charity, providing effective support, the reality is that we are only reaching 40% of newly diagnosed stroke survivors. And we know that we need to influence more system decision makers to prioritise stroke. We were also aware that the organisation had grown quite fast, but very organically. And that meant there was huge inconsistency in ways of working and a lot of variation, as I said before, in where our services are actually available. Our costs had risen, but our income was plateauing. And that meant that even prior to COVID, Alison, we were running an operating deficit, which is not a comfortable position for a charity to be in. And our tools, systems and processes, frankly, are not modern. They don't join up. They're not easy to use. You will know that, Alison.
Yeah.
A lot of people in this audience
Yeah.
will have frustrations with some of our systems. So we knew we needed to change. But the big thing that we really wanted to get right was to increase our reach and impact for people affected by stroke. So next slide, please. So what we have done is we have designed a new operating model, and we have restructured how we operate across the UK. Now, this map of the UK shows the 10 localities that we have now organised our teams around. We have localities in Scotland, Wales and Northern Ireland to reflect the devolution in political and health systems that exists in those 3 devolved countries. And in England, we have organised ourselves into 7 localities. And those 7 localities map very neatly on to the 7 NHS England regions. And we now have more capacity in each of those 7 localities to both deliver services, but also to engage with system decision makers. And we've set the localities up to improve treatment and support for stroke survivors and their families, to influence local decision makers to prioritise stroke, to deliver high quality stroke support services, and to engage with communities, including groups like yourselves. Next slide, please.
Juliet, can I just interrupt and just ask you, in amongst all this, COVID came along. Did that affect how the workflow continued, and has it affected costs and things as well, I suppose?
Yeah, it's a really good question, Alison. So we started redesigning our operating model prior to the pandemic. Then the pandemic came along and we paused the work. We rethought how we are going to increase our reach and influence, frankly, with lowering our cost base. I'll come on later to talk about the fundraising challenges that we've had, but we have, unfortunately, like many charities, had to make expenditure cuts. So that has also been a factor behind the redesign. But we did start the work prior to the pandemic because we knew that we really wanted to increase our reach and our influence.
Yeah.
So this slide shows who your key contacts are in each of the 10 localities across the UK. We now have dedicated what we're calling engagement teams, and they are teams that work exclusively on community engagement and then system engagement, which is influencing system decision makers to prioritise stroke. And you can see here who your key contacts are. Some of those key contacts may be familiar to you because actually quite a number of people from our previous volunteering and community team have moved into the engagement roles, but the roles are different and they will work in slightly different ways. So hopefully you've all had contact with your engagement lead, and if you haven't, they will be reaching out to you very soon. And next slide, please. The next slide shows who you can contact if you want to meet or talk to your local engagement lead. So the key email address for you to use if you want to connect with somebody locally is groupnetworks@stroke.org.uk. Now, in addition to the local engagement teams, we also have a national team that is going to be supporting stroke groups going into the future. So that national team is led by Catherine Staley, and there are 3 individuals in that team, of which one of them is Beth, who I think you all know. And this national team is really responsible for making sure that the right infrastructure, systems and processes are in place to support groups. So it'll be this team that will produce the UK guidance and tools to help groups be as effective as possible. So just as one example, they can help you update your group information on the website. So if that's something you want to do, please do get in touch with this national team. And we also now have somebody in our finance team whose job it is to support group treasurers. That person is Linda Spilsbury, and you can contact Linda on the email address groupfinances@stroke.org.uk. So I think it's fair to say that these arrangements are new. They've only really come into effect from September, October time. And because the arrangements are new, it is perfectly possible that we're going to have some teething problems. I don't want to pretend it's all going to be plain sailing, but please do, if you're finding any particular challenges, please do get in touch with you, because our commitment to you remains unchanged. We absolutely want to make support groups as effective as possible, and we are increasing our support not just for Stroke Association support groups but for affiliated groups too, and we want to connect you more to each other. And you'll be able to find out a bit more about our vision for the Stroke Group Network, what we've achieved in the last year, and our plans for the future in the next session today. So I do hope you're all able to join for the next session. And I would just like to build on Beth's important point about partnerships. We really want to play our part in helping to connect you to other useful organisations. And if you go into the virtual exhibition space, you'll be able to connect with Interact Stroke, who've been very loyal supporters of this Stroke Group conference for many years and provide a wonderful service, but also Ability Net, who are a great organisation who are here to help provide support for people to get online. So if you're interested in either of those things, please do go to the virtual exhibition space.
That's it's really interesting, and it's also really nice, Juliet, to be able to put some names, particularly locally, so that we know exactly who we need to contact in our local areas, because we do seem quite spread out across the whole country. But it's really great for everyone to be able to get together here today. So it's all sounding positive, despite all the challenges that we've had over the last year or two now. But what's been the biggest challenge, Juliet, facing the Stroke Association since we last met at conference in October 2020?
Yeah, next slide, please. I mean, goodness me, it's been one hell of a ride over the last 18 months. And I would say that the pandemic has impacted almost all aspects of stroke treatment and care. It's been a really tough time for stroke survivors and their carers. At the beginning of the pandemic, you may remember in March, April time last year, we saw a huge reduction in people presenting to emergency departments in hospital, and we saw a corresponding reduction in people presenting at hospital with stroke symptoms. I think people were just frightened to come to hospitals and didn't really want to bother the health service when they knew the staff were just so overwhelmed. But that was a real worry to us, as you can imagine. We also surveyed 2,000 stroke survivors and their carers in the summer last year, in June 2020. And they told us some really worrying things. We heard that people were being discharged earlier from hospital, sometimes with greater levels of disability. We heard that stroke rehabilitation was quite hard for a number of stroke survivors to access because a lot of it went online or was delivered remotely. And for stroke survivors with more severe strokes, it was really, really hard for them to access any rehabilitation. And then we heard about really worrying levels of anxiety, about another stroke, anxiety about catching COVID, really worrying levels of mental health. And that included amongst carers, because a lot of the support services that carers might previously have benefited from fell away. And obviously family and friends were not able to visit in the same way that they were before. So a lot of our carers were really struggling on their own, feeling really burdened and isolated and lonely. So it was a very difficult time for stroke survivors and their carers. And I think it's fair to say, Alison, it's still challenging now. We're hearing a lot of stories, aren't we, in the media about ambulance response times. And I don't know whether you've noticed, but the Stroke Association has been kind of out there in the media in the last 24 hours speaking about our concerns about slower ambulance response times for stroke survivors. And we have also seen a deterioration in thrombolysis rates, the rates of delivering the essential clot-busting drug. So we're not out of the woods, and there's a lot for us to do to make sure that stroke does not get overlooked. I think there's a couple of other areas that have been challenging over the last 18 months. Our stroke research has been really badly affected. In line with a lot of other medical research charities, we had to cut our research budget in half. And that's obviously a concern, because it's through research that we create the breakthroughs for the future. And it's been very tough in financial terms. Everyone will know that at the beginning of the pandemic, all community fundraising, all running, walking events, coffee mornings, they all stopped with immediate effect. And in May last year, we did an emergency budget, and we were forecasting a £5.7 million deficit for the charity. And that really was scary, Alison. I mean, that really kept me awake at night, because I was really worried. But, I have to say, the Stroke Association has got healthy reserves. We benefited from some one-off grants, including furlough income from the government and a big grant from the Department of Health and Social Care. And we've had some new funding streams, including Barclays that we've mentioned before, but also in Scotland, the Community Fund have given nearly £200,000 for our community work over the last 3 years. And we got a big £450,000 grant from Garfield Weston Foundation for some new services. So I am really pleased to report that actually we ended up last year with a very small financial surplus, which was so different from what we expected. And we are financially sustainable going into the future. So that's a real relief. But it's been a tough time for charities. And there are some local charities and community groups that haven't had the benefit of reserves. And, some of them are really struggling. And sadly, some local charities, including, groups that would have been there for stroke survivors, are having to close. So, that makes kind of support for stroke survivors that little bit more challenging.
Yeah, it's been really tough, and I think certainly down in the community level, it has been tough as well. But I suppose we all have to just keep going, don't we, and remain positive, and just try and just be there as much as you can be, and try and keep everyone safe. Really, is our aim. But I do believe that every cloud somewhere has a silver lining, Juliet. Don't you? I think we kind of have to believe that. Otherwise, we would just, we'd all just go to bed, wouldn't we? Really.
I think that's true.
So let's talk about highlights from the past year, and feel positive about it.
Yeah, so next slide, please. I mean, there have been some highlights, and I just feel so proud of how people affected by stroke and the Stroke Association have responded to the challenge of the pandemic. And we've done some great work. So I said earlier that we noticed a really dramatic reduction in people presenting at hospital with stroke symptoms in sort of March, April last year. So we ran a Stroke is a Medical Emergency campaign. We promoted Act Fast, and fortunately by last summer, stroke units were back to near normal levels. We managed to persuade Public Health England again to run the Act Fast campaign on television in March, April this year. So that was great. We published our Stroke Recoveries at Risk report in September last year, really with a message to government that you've got to deliver on your pre-pandemic commitments for stroke. All of our services immediately pivoted from face-to-face to online. Our groups were amazing, and I'm going to come on to that in a minute, but so too were our stroke coordinators, who had to adapt overnight to providing support remotely. We invested a lot in our coronavirus information on our website. We created some really good information and support for people, including some lovely videos, specifically for people with physical impairments, that we did with a charity called A Stroke for Luck, to show people how you can actually keep physically active while you might still be in a wheelchair or seated. And so some of those videos have been really well received. We produced a guide for how to get online for people with aphasia. I think you'll all be pleased to hear we've listened to your feedback about my stroke guide, and it's great news. You no longer have to log in to my stroke guide if you want to access the core stroke information. So if you want to find out more about the new features of my stroke guide, you can go to the online exhibition area. And I'm just really pleased because we reached more people last year than we'd ever reached before. We increased our reach for people affected by stroke by 7%. So that was really considerable. And we also, I said earlier that we had to cut our research budget by half, but we took the opportunity to actually understand what are the future stroke research priorities. And we now have a fabulous report that gives us a platform for lobbying for more funding for stroke research. So, some highlights that, I feel really proud of and that have been a real team effort. Next slide, please. Now, the other thing that we've done in the last 12 months is a number of campaigns to both make people aware of the support that we can provide to stroke survivors and their families all across the UK. But we're also continuing to promote positive messages about stroke. We know that there continues to be a fatalism around stroke. Not everybody realises that there is the possibility of recovery, and not everybody realises how important having hope is to actually continuing with your recovery. So we are live at the moment with our Hope After Stroke campaign, and we have some wonderful stories from stroke survivors on our website and on social media promoting the very real difference that hope has made to them when they might be feeling a little bit bleak. But, some small goals or something that someone has said to them have given them incredible hope for the future. And last but absolutely not least, I have to say, stroke clubs and groups have been amazing. So I remember at the beginning of the pandemic, there was understandable reluctance to move your support online, but it's just incredible. I mean, 2/3 of stroke clubs and groups have managed to keep their support going online. We've seen some incredible innovation, with singing groups operating across the UK, new groups springing up for younger stroke survivors, for Black and minority ethnic stroke survivors. So some real innovation. And if you want to find out more about some of the really innovative, creative ways that stroke groups have been working, there's a great session tomorrow at 11:40 where you'll hear how groups have been working online and blended. And I'm really pleased to say that we've got over 150 Stroke Association support groups now back face to face. It's not easy. But, I think you're all being very pragmatic. We have got lots of guidance and tools for you. We are asking you to complete risk assessments. We're following government guidance, but we're also recognising that you want your groups to be safe too, and that you're putting in place appropriate precautions. So, Alison, I know your group is managing to get back, isn't it, to face-to-face meetings?
Yes.
How's that been?
That's us there, actually. The photographs at the top
Brilliant.
there is Falmouth Stroke Club. They're all looking very jolly and waving, I think. But yes, Juliet, we have got back to face-to-face. And I'm sure resuming face-to-face, as I'm sure other groups will agree, has been quite daunting with the roller coaster of the changes in the rules as well. We kept kind of hoping that we were going to be able to, and then it felt, oh no, this doesn't feel very safe. So, and it's quite a responsibility as well to bring, a group of vulnerable people back together. And I did start by looking at the Stroke Association guidelines and risk assessment. That was a really good start for us, just so that we felt we had some kind of, tool with which to start the group opening again. However, after all that, it really wasn't too bad in the end. Over lockdown, some of the members were able to join twice weekly meetings online, and the club and Simon, the local Stroke Association community officer, we pooled our stroke survivors across the whole of Cornwall and our brain power to provide coffee mornings, talks and art groups and yoga sessions. And we also had regular phone contact and a monthly newsletter with news of members and lots of stories. But to be honest, I'm sure, like everyone else, the last 18 months online, we were just so over Zoom, we couldn't believe it. It was great, but we just wanted to be together. Desperation comes to mind, really. We just wanted to be in the same room. So we spent the summer making plans, and as you can see, we're very lucky. We've got a large area hall, so we could keep apart. Having said that, I have to admit there was a bit of hugging going on, but we'll just gloss over that, really. So yeah, keeping everyone apart was really hard, and we do have lots of ventilation. At the beginning, we sent a letter out to all the members stating our plans to restart and the measures that we were taking, and hoped very strongly that everyone took up their vaccination offers, which they did. They're wearing masks, wear warm clothes, and using sanitizer, and asked them not to attend if they were ill or if they'd been in contact with anybody with COVID. We've not yet had outside speakers. We've been doing the entertainment ourselves, and I'm sure that will begin to get a bit boring after a while. But we just felt it was safer to start with. And we did discuss actually lateral flow tests, because I'm sure a few people will wonder about that. But we just felt it would be a bit divisive and very difficult for some members to do. And it wasn't within the guidelines. So we just felt we need to take all other precautions. Ventilation is a big one, and wearing our masks. As you can see, our two kitchen ladies there are volunteers wearing their masks in the kitchen. So we met again on the 3rd of September, and it was such a happy occasion, extremely emotional. the joy, the noise, and the chatter and smiles were lovely, and that was just the committee members, never mind the members. It was absolutely amazing. We just hadn't really realised how much we'd missed it. So we're keeping a watchful eye on the COVID numbers down in Cornwall. We're being really careful with our restrictions, and we're now planning our activities for the new year and hoping to have some outside speakers. But no, I think everyone all over the country's found it really, really hard. So I hope that they will try and get back together again if they haven't already, because it honestly is not so hard. It's worth it. So yeah, thank you, Juliet. So after these roller coaster years, Juliet, what's your one wish for the Stroke Association going forward after COVID-19?
So next slide, please. So Alison, I hope you don't mind. I'm going to cheat. I've got 3 wishes. Which I know is
wow.
Cheeky, I know.
Okay, we'll let you off.
Okay, so my first hope is that stroke has the same public and political priority as other long-term conditions like cancer and heart disease. I mean, we know stroke is under-recognised, it's underfunded, and yet the scale and impact of stroke is huge. But, you know, there's so much that can be done. Stroke is preventable, stroke is treatable, and stroke is recoverable from. And so I really hope that people will realise that investment in stroke services is really worth it, because it can make such a difference to tens of thousands of people's lives. My second wish, actually, is that stroke is a cause that tens of thousands more members of the public will engage with and want to volunteer for. And we've seen during the pandemic just amazing community action and volunteering, people helping out with, you know, shopping or picking up prescriptions, or just, you know, showing real kindness to their neighbours. I really hope that we can mobilise and support people to want to take action on stroke in their local communities, because nearly everybody knows someone who's been affected by stroke. And then the third thing that I would love is for the Stroke Association to be there for every newly diagnosed stroke survivor and their carer. I said before, we're only reaching 40% of newly diagnosed stroke survivors, and we are absolutely committed to expanding our local services, expanding some of our wonderful universal services. And I forgot to mention that one of the highlights of last year actually was the 2 new services that we created. Here For You, which is the volunteer phone support service for stroke survivors feeling lonely and isolated, but also Stroke Association Connect that we deliver with the NHS and involves phoning people when they're newly discharged from hospital. You know, we're really committed to expanding local services and universal services, but also, you know, we do want to drive more referrals to stroke support groups. We know it's quite a challenge for stroke support groups. You offer a wonderful support service, but sometimes I've heard there's a bit of frustration that people are not always told about local stroke clubs and groups. So I think there's something for us to do to connect with the hospital stroke teams and to really get that message out there to system decision makers that peer support through stroke groups makes a big difference. And we are working on a policy document with the NHS in England all about what good should look like for life after stroke services, and there's a big emphasis on the importance of stroke support groups within that. So I would love those groups and all of our services to have greater reach.
Thank you.
So I just want to say thank you. I'm here now for any questions. And I'm around for the rest of today. Very sadly, I won't be able to join you tomorrow. But I'm around for the rest of this morning. So yeah, I don't know, Alison, what questions are coming up, or
I don't know.
Beth?
Let's see.
Hello. Oh, thank you both so much, Juliet and Alison, for such a wonderful start to the conference. You've covered such a breadth of information and professional reflection. So a huge thank you. I'm just going to bring Anne back for a quick moment because I know Anne's been looking and monitoring and engaging on the chat box. And would you like to share any reflections that are coming through before we go into questions, Anne?
Thank you, Beth. Yes, lots of reflections going on in there, and people agreeing with Juliet's wishes and hopes for the future, but particularly Tracy, who reflected on her own experience. And she said, I was given no information about any organisations, and I had to do all the research myself when she left hospital after having her stroke. She felt very alone and extremely frightened about her future, but then she joined her local stroke group and she met other stroke survivors, and it helped her with no end. So yes, it's good to hear that the Stroke Association are going to do more to promote groups and work with hospitals. Many stroke groups have lost their funding, and the groups have had to finish. That was a point that Steve wanted to reflect on. And Elizabeth noted that in a newer rehab unit where she is part of, they've noted that music therapy has made a noticeable difference to stroke patients, particularly those who've had stroke in younger years that have been brought about by COVID and presenting aphasia symptoms. And that it's been noticeable that the patients have been admitted with stroke symptoms after a traumatic brain injuries, partly due to the lockdown and more accidents and things on the road. So that was just picking up on some of the things that Juliet was talking about as we were going along.
Thank you, Anne. Thank you for sharing those. It sounds like people are having a good opportunity to share and reflect, and that's what this is all about. So thank you so much for engaging in this forum. So we've got a few minutes for some questions to Alison and Juliet. So we'll bring them back on. And I do want to say that we will be sharing this recording and we'll be sharing the slides after the live event. So we will get those out to you. So we've had a few questions come through. I'm going to start with the one around the strategy, probably, Juliet. So we had a reflection where it talks about everyone affected. And it needs to include carers when we're saying everyone affected by stroke, but perhaps the goals wording doesn't appear to make that really explicit. So do you want to say something about that phrase, that term, everyone affected?
So I think that's a really fair comment. We've used the phrase people affected by stroke to cover stroke survivors, but also their immediate carers and family members. The reason why we haven't used the word stroke survivors and carers is because not everyone who's supporting a stroke survivor is comfortable with the term carer. We've actually found that out from some of our research because, you know, they may be neighbours, they may be, they may not be partners, they may be siblings or children, and you know, they're just supporting their loved one. And so we've come up with the phrase people affected by stroke to kind of cover the whole community. But I think it's a fair challenge, and maybe is something for us to reflect on, that we need to make more explicit that we're there for carers as well as for stroke survivors themselves.
Thank you. We've had a few questions around what you picked up on at the end there, actually, in terms of being able to promote stroke support groups within hospitals and the healthcare system. So I think that's been covered. So thank you so much for that, the work that you were saying that was happening at different levels. We have had a question about FAST. So on the website, can pages be changed to include those people who don't present with FAST symptoms, which is quite an interesting reflection. I don't know if,
It's a really great question, and actually this comes up quite frequently as a question. And there are other slightly more sophisticated versions of FAST that recognise some other symptoms, like
Vision,
struggling with your eyesight or dizziness. I mean, Alison, you'll know better than me.
Yeah, balance. Yeah,
balance. So eyesight balance, there's something called BFAST, which recognises balance and eyesight. But also, sometimes people just have a funny turn, which can often be a sign of a minor stroke, a TIA, which can be a precursor to a more major stroke. So I think our message is, if you feel at all odd, you know, if you show any one of the main symptoms of stroke, but also if you're showing other symptoms that you're just, you know, concerned about, always urge on the side of caution. Always call 999, because it could be a medical emergency. And maybe, to your question about our website, maybe we should just look at those website pages just to make sure that we are reflecting that there are other symptoms, and that, you know, always urge on the side of caution, do call 999. So it's a great question. Alison, was there anything else you wanted to add from a nurse background?
No, I don't think so. It's quite complicated, isn't it, really? And we have a lot of patients that come into the emergency department with things called stroke mimics, but they're always, you know, we used to see them as if they were a stroke, and then, you know, they were then filtered out because they were some other stroke, what they call a stroke mimic, like maybe Bell's palsy or something like that. But yeah, it's a really difficult diagnosis to make sometimes, but you're very right to say that, you know, if you're worried at all, just get yourself seen by, you know, a health professional.
Yeah, and you know, it's the scans, it's the brain scans that are so critical, because it's the brain scans that tell you whether it is or is not a stroke.
And our brains are like our computers; they're so complicated, so you can get any symptom, you know, really. But yes, err on the side of caution, I think, is the right thing to do.
Thank you both. It just ties into another point, actually, that someone's reflected. Has anyone had experience of a covert or silent stroke, as they think they've had experience of it as a result of a complication of an anaesthetic? So that's just another element of symptoms and cause, isn't it? So I don't know if you want to comment on that, or we can pick that up with the attendee afterwards.
It's probably just like another stroke mimic, I think, probably.
Yeah, and we do know that, you know, people undergoing surgery can unfortunately have complications, and one of those complications can unfortunately be a stroke. But I haven't heard the term silent stroke before.
No, and also just if you've had an anaesthetic as well, that can make you feel very strange.
Yeah,
just the anaesthetic itself. That'd be an interesting one to explore.
Yeah, we'll pick that one up. We have had a question around vaccination, and could we ensure that members who, you know, come to stroke association support groups are double jabbed? Could we make that compulsory? And we know that can probably make open a big discussion, and we've got 1 minute to go. So if you wanted to reflect on that for a minute, but what I would say is we've got a whole session tomorrow about face-to-face recovery in the morning, of which Neil Jarman, our health, safety, wellbeing partner, will be talking about our position in great detail. So we can pick that up there if people want to join. So yes, I think due to time, if there are questions that we haven't got to, we will absolutely pick them up, either in follow-on sessions or in the information that we send around afterwards. So I want to send an absolute massive thank you to the two of you for kicking off our conference. It's been wonderful. I've learned a lot, and I always enjoy it. So if anyone does want to connect with this conversation afterwards, do press the contact us button, and we can pick up some of your questions there if you're not using the chat box. And we've also got a quick poll as well, which we would love you to do. It's at the end of the chat box, just underneath that, to just say, have you found this session useful? Because we really want to make sure that the content is good for you, and we can learn from it for future events. So yes, thank you everyone for joining this first session. There'll now be optional breakout rooms that we're going to try before the next session at 11:30. So this means you can get your drink, your coffee or tea, join one of those 2 informal conversation rooms. You can have your camera on or off, but you can speak to people as well. You can actually meet some of our senior leaders. So that's Alexis, Michelle, and Catherine. And you can have a chat with them. And the other breakout room, you can connect with each other as attendees and have informal conversations. So hopefully we will see you at 11:30 for the next session on introducing our stroke group network. So if you leave your screens on, if you're not joining breakout rooms, just leave your screens on and we'll see you then. And a big thank you, Juliet and Alison.
It's been a pleasure. Thank you, and
Okay,
lovely
bye.
chat, Alison. Bye-bye.